Chapter 6. Diet concerning age groups. Welcome to our channel. Food as medicine. You are what you eat. Toddlers and preschoolers. Children between the age of 1 to 3 are defined as toddlers. In this age, the development is rapid. This stage of development is considered a rapid increase in social and personality-enhancing skills with succeeding increases in autonomy, ability to explore the environment, and improved language skills. Preschool-age children lie between the age of 3 to 5 years. At this age, a child's stage of development includes increasing autonomy, facing vast social conditions, such as spending time in preschool or interacting with friends and relatives. This social interaction increases language skills and escalating the ability of the child to have power over behavior. Poverty, a leading cause of undernutrition. There is a dire need for an appropriate energy intake or calories for the preschoolers and toddlers to give the best performance throughout their daily activities. Lack of adequate nutrition in children during these years spoils the cognitive development of children. Undernutrition also harms the ability of children to explore the environment. These long-term consequences of undernutrition, such as failure to bloom and impairment of cognitive development, can be tackled or prevented through adequate nutrition and a healthy lifestyle. The healthy living of children is estimated by the rate of children living the life of poverty. The rate of children living in poverty has increased spectacularly in recent years. In the year 2006, the rate of poverty was 18%. 33% of children had faced full-time no parenting, and 14% of these children had no health insurance. In 2006, 33% of children, or about 22 million, lived in single-parent families. All of these factors made them more likely to face poverty. When doctors or dietitians evaluate the nutritional status of young children and provide education and awareness of nutrition to their parents, the critical thing that should be considered is the environment in which children live. It is not possible to set up healthy eating habits in the environment of poverty and food insecurity. Some differences exist in the health status of children due to different races and ethnicities. Eating habits of toddlers. Parents should keep in mind that the loss of appetite is a normal thing at toddlers' age. This is because of slow growth in toddlers. Toddlers have newly established gross and motor skills. They are excited to go to new places and explore new environments. If your child gets easily distracted during mealtime, then there is no need to worry. It is a normal part of the development or growth of your child. Your child needs a toddler-sized portion at this age, according to its ability to digest and body's needs. There is a rule of serving size. One serving that is 1 tablespoon for a child of 1 year, and the number of tablespoons increases with the age of a toddler. Following this rule of thumb or tablespoon, a 3-year-old child serving would be about 3 tablespoons. It is suitable for a child to give him a small portion and then ask him for more food instead of serving a large portion in front of him. Parents usually miscalculate the portion sizes needed for their child's proper growth, which contributes to making your child a picky eater. The reason behind this is that toddlers are unable to eat large portions at a single time. Snacks are a fundamental part of fulfilling the nutritional needs of your child. It is essential to keep in mind that you should completely restrict your child from junk food and sweetened beverages during snack time. These snacks can eradicate the small appetite of toddlers for breakfast, lunch, or dinner. The eating pattern of toddlers should be organized. It should be based on flexible timings of breakfast, lunch, and dinner. There should be a gap in between meals that would increase their hunger. This makes them eat proper and adequate food at specific mealtimes. Dietitians and doctors advise parents to allow toddlers to eat in hunger rather than forcing them to eat when they have no hunger. Eating habits of preschoolers. It is observed that the preschoolers are mostly picky eaters. There are several reasons behind this problem. The main problem is that the child has limited exposure to food. He has experienced a limited type of food since his birth. His tongue is introduced with a particular taste. Doctors and dietitians avoid parents making a battleground between a child and them. This can make a child pickier towards eating. Diet experts advise parents and caretakers to present food in front of their children in an attractive way. Parents observe that their child does not like salads, different items mixed in the same dish. They also do not like foods and vegetables with beefy flavor. Children of this age also avoid spicy foods. Preschoolers and toddlers are considered picky eaters, and their parents are advised to avoid random eating between breakfast, lunch, and dinner. These manners often kill the hunger at mealtimes. Children should not be forced to eat and stay at the table long without their will. Diet for toddlers. Diet is designed for the reduction in the levels of high blood pressure. If we talk about toddlers, children from 1 to 3 years usually do not have hypertension. They can have primary or secondary hypertension. Primary hypertension comes from family, and it is hereditary. Toddlers may face the complications of hypertension due to renal parenchyma disease, renal vascular disease, endocrine diseases, coarctation of the aorta, iatrogenic disease. Hypertension in toddlers is mainly due to kidney diseases. According to the data of NHANES, 2007-2008, 10.4% of the children with ages 2 to 5 years had BMI for age percentile superior to or equal to the 95th percentile. Obesity is now common in toddlers worldwide. This is due to bad eating habits developed by their parents. Children who are addicted to junk food have a problem of obesity or being overweight. It is harmful to the health of your child. Diet can be used for both cases, either for hypertension or obesity in toddlers. It emphasizes the ingestion of fiber, which is overall good for child health. Through the diet, a child can get all the essential nutrients required for normal and healthy growth. A consultation from a dietitian is required. He can better tell what to eat and when to eat. Besides this, the diet can also be helpful for the healthy living of toddlers. It makes your child healthy by providing all the essential nutrients to the body of your child. It gives protein, calcium, potassium, magnesium, fiber, vitamins, essential fatty acids, etc. It can also be used if a child has any cardiovascular disease. Hence, the diet can apply to toddlers. Diet for preschoolers. The causes of hypertension are the same in toddlers and preschoolers. Obesity and hypertension, both diseases that exist in preschoolers. Preschoolers can follow the diet for healthy living, hypertension, obesity, cardiovascular health. For a preschooler, a consultation with a diet expert is a must. He will guide the adequate amount of different foods to be consumed at different times of the day. Adolescents. We eat food for various reasons, but the most compelling reason is the body's need for energy or calories, nutrients, and other substances required for proper body functioning. A calorie is a measure of the amount of energy. It is derived from the food we eat and transferred to the human body to meet the daily energy requirements. A calorie is a unit of measure and not a substance actually present in food, so it is not considered nutrients. Nutrients are chemical substances in our daily food items that the human body uses for various functions that support normal growth, development, tissue repair and maintenance, and overall health. Essentially, every part of our body, i.e., cells and organs, was once a nutrient consumed in food. The nutrients that the human body requires are carbohydrates, amino acids, essential amino acids, fatty acids, i.e., linoleic and alpha-linolenic acid, vitamins, minerals, and water. At the same time, non-essential nutrients include cholesterol, glucose, and creatine. All humans need the same nutrients, but the amount required varies and depends on many factors like age, body composition, gender, growth, illness, lifestyle factors like smoking, alcohol intake, medications, and several other factors. Nutritional needs are determined and modified by sexual maturity and age, biological age, instead of chronological age. Adolescence is 12 to 21 and is characterized by substantial physical, cognitive, and emotional maturity. These changes have direct effects on their nutritional status. On the other hand, unhealthy and healthy compromising eating behaviors like excessive dieting, meal skipping, and use of unconventional nutritional and non-nutritional supplements, and the adoption of fad diets are also very prominent during this age period. Only a few adolescents meet their nutritional requirements, i.e., fruits, vegetables, whole grains, vitamins, minerals, water, and others exceed their nutritional needs. Usually, adults view adolescence as a chaotic, imprudent stage of life that children must go through. However, this perspective harms the importance of development in this phase. The experiences in this phase of life are very much different than the experiences of the toddler phase. It includes advancing a personality and achieving a unique status separate from parents and other family members. It includes a struggle for personal liberty escorting by the need for money and social support by family. There is also a need to cope up with body changes that occur during this phase. When we see these imprudent behaviors practically and positively, they seem to be a unique, positive, and essential change in life. This makes an adolescent a responsible citizen. These changes need immense power to make things going on their paths smoothly. The puberty of females starts between 10 to 14 years, while males' puberty starts between 12 to 16 years. Nutritional needs. All of these biological, psychosocial, and cognitive changes that occur during adolescence directly impact the nutritional status of adolescents. Due to these changes, the need for energy increases, and the need for essential nutrients required for growth increases, such as protein, vitamins, and minerals. Eating behaviors during adolescence are also affected by food preferences, food availability, cost, convenience, religious beliefs, and many other socio-economic, psychological, biological factors. Nutritional messages and counseling can have a huge impact on their health and protect them from long-term health risks. A good nutritional status can greatly affect their athletic and academic performance and positively affect their appearance. Calcium intake plays a key role in the bone mass growth of adolescents. But calcium is usually consumed less than its recommended value in this age. It can harm their bone health and may also deplete their calcium deposits. Being physically active is also very important for bone mass. An increase in lean body mass, skeletal mass, and body fat during puberty, resulting in increased nutrient and energy needs. Physical maturation that has occurred during this life stage corresponds with their nutritional and energy needs. Energy needs are directly influenced by their basal metabolic rate, BMR, physical activity level, and increased requirements to support their growth and development. BMR is directly related to their lean body mass. Adolescent males have high caloric, energy, needs due to their greater weight, height, and lean body mass than adolescent females. Data suggest that adolescents in the United States usually consume a diet depleted of certain nutrients and is high in dietary sugar and fats. Protein needs during adolescence are influenced by the amount required to maintain their existing lean body mass, plus the amount required to accrue additional lean body mass during the adolescent growth spurt. The protein required for adolescents is 0.85 grams per kilogram body weight per day. This value is slightly higher than the adults. Protein requirements are highest when the growth is at its peak. Carbohydrates are the immediate and primary source of energy. Food with a high carbohydrate content like fruits, vegetables, legumes, and whole grains is also high in dietary fiber. The recommended carbohydrate intake is 130 grams per day, and it constitutes about 60% of total daily energy requirements. Artificial sweeteners and added sugars provide about 21% of total energy needs. Foods high in sweeteners include baked items, soft drinks, and sweetened beverages are the major food sources of sweeteners. Dietary fiber is essential for normal bowel function and may prevent various diseases like diabetes, cancer, etc. Adequate fiber intake is the key. Dietary fiber is thought to reduce serum cholesterol levels, blood sugar levels within the normal range and reduce the risk of obesity. The recommended intake of dietary fiber for adolescent females is 26 grams per day, and for males, less than 14 years of age is 31 grams per day, and for older adolescent males at 38 grams per day. Dietary fiber intake among males increases slightly with age during adolescence, decreasing with age among females. The low intake of fruits, vegetables and an average intake of less than 1 serving of whole grains per day are the main factors affecting fiber intake among adolescents. Diet. Dietary approaches to stop hypertension, is a very healthy eating pattern for adolescents because it focuses on eating various fruits, vegetables, whole grains. This dietary pattern includes foods from all food groups and follows the dietary recommendations of USDA. Adolescents usually consume a high-sodium diet, and some of them suffer from hypertension. Other risk factors for hypertension among adolescents include a family history of hypertension, high dietary intake of sodium, overweight, hyperlipidemia, inactive lifestyle, and tobacco use. Some adolescents also have high cholesterol levels, which is the main underlying cause of cardiovascular diseases. DASH diet can be very effective for these conditions. Adults. Introduction. Adulthood is the age period of very long and active growth and development between infancy, childhood, adolescence, and older adults. It is a life stage of sustaining the mental and physical capacity. The age period between 20 to 64 is where the diet, physical activity, and smoking habits greatly influence an individual's future health. 5 of the 10 leading causes of death have risk factors that we can modify by a good diet and physical activity, i.e., cancer, diabetes, hypertension, heart disease, and stroke. These are preventable, and one can reduce their onset and severity by adopting a healthy lifestyle. Dietary risk factors for the onset of cancer include low fruit and vegetable intake, low level of antioxidants, especially vitamins A, C, low intake of whole grains and fiber, high dietary fat intake, nitrosamines, burnt and charred food, high intakes of pickled and fermented food, alcohol consumption, high animal foods, and low plant food intake. While a lifestyle approach that has high saturated fat, greater than 10% calories, trans fatty acid intake, dietary cholesterol intake greater than 300 milligrams, low antioxidants, low fruit and vegetable intake, low intake of whole grains, no or excess alcohol, high waist circumference, men greater than 40, women greater than 35 inches, elevated plasma ApoB levels, high levels of LDL cholesterol, especially in men, low levels of HDL cholesterol, especially in women, high blood triglycerides, glucose intolerance, hypertension, stroke, high sodium, low potassium, low milk and dairy foods, excess alcohol, low levels of antioxidants, have a contributing role in the development of heart diseases. Adulthood is subdivided into the following categories. Early adulthood is the period of 20s, a period of schooling, self-independence, and looking for other life opportunities. The 30s is characterized by very high social responsibilities like looking after children, caring for loved ones, and other social tasks. Midlife, which encompasses our 40s, involve active family, professional, and work-related responsibilities. The 50s are also referred to as the sandwich generation, in which work and career are the top priority of an adult and health concerns. Old age is the phase of the 60s, where most of the adults are getting retired from their jobs and play their responsibilities as guardians. Physiological changes. Most individuals stop growing by the time they reach their 20s. However, the bone density of both men and women continues to develop until age 30. Muscular strength is affected by muscle size, weight training, and regular use of muscles. The type and duration of physical activity also play a key role in this aspect. Muscle mass, flexibility, talent, and sensory abilities gradually decline with age, while the body fat increases. Hormonal changes. The decline of estrogen production in women results in menopause. Menopause is the end of menstruation. It is associated with an increase in abdominal fat, and there is an increased risk of cardiovascular diseases and loss of bone mass. Men experience a gradual decline in testosterone level and muscle mass. Physical activity and weight training to increase muscle mass result in small and transient increases in testosterone level. Obesity is associated with higher estrogen levels in both men and women. Energy needs. The energy needs of an adult are based on an individual's metabolic rate and the thermic effect of food. A major part of total energy expenditure, about 75%, is associated with the involuntary chemical activities that occur within the body. Body organs like the kidney, liver, brain consume about 60% of the basal metabolic rate, BMR. Calories intake based on macronutrient content for adults are fats 20–35% of total calories, carbohydrates 45 to 65%, and protein 10 to 35% of total calories requirement. Fiber. Dietary fiber recommendations are 38 grams for adult men and 25 grams for adult women, or can also be evaluated as 14 grams of fiber per 1,000 calories. Dietary fiber is essential for the overall health of an individual. It reduces the absorption of cholesterol from the gastrointestinal region. It also positively affects the blood glucose, lipids levels, and body weight of an adult. Food choices included in the DASH diet, such as fruits, vegetables, whole grains, provide a considerate amount of dietary fiber. Vitamin A. Vitamin A is a fat-soluble vitamin essential for cell differentiation, vision, immune function, and certain other functions. It keeps the mucus layer healthy and protects the skin from any infection-causing agents. Sources of vitamin A include vegetables, fish, carrot juice, etc. These food groups are included in the DASH diet. Deficiency of vitamin A causes xerophthalmia, night blindness, and keratinization. Adults, due to their unhealthy eating behavior, gain extra body weight and become obese. Adipocytes are not just the passive deposits of extra fat. They constitute an endocrine system and secrete certain factors associated with low-grade inflammation and may lead to other health consequences. Obesity is not simply a matter of excess calorie intake. It is a set of complex physiological, individual, and environmental factors. Environmental factors include food advertising, the ease of availability of highly palatable food items, larger retail package sizes, larger portions served in fast food and sit-down restaurants, and the relatively low cost of fast food and energy-dense foods work against healthy eating and contribute to the obesity epidemic. Body fat content and its distribution are more important health indicators than body mass index, BMI. Overweight, obesity and abdominal fat are correlated with disease risk in a dose-response manner. Increased waist circumference is associated with higher risk even in persons of average weight. Even a small amount of weight loss, 5%, can reduce or prevent the health risks associated with obesity like diabetes, cardiovascular diseases, etc. The goals of weight management should be to prevent any further weight gain, reduce body weight, and maintain lower body weight for the long term. Accomplishing this requires sustainable lifestyle changes, i.e., a healthy and balanced diet, physical activity. Calories deficit is necessary to lose weight. A calorie deficit of 3,500 kilocalories is needed to lose 1 pound of body weight. Similarly, a calorie deficit of 300 kilocalories, 500 kilocalories, and 1,000 kcal are required to lose 1/2, 1, and 2 pounds of body weight per week. Losing weight is not a major issue. Maintaining healthy body weight is key to sound health. Dietary approaches to stop hypertension, DASH, is a dietary pattern that focuses on eating healthy foods. Foods that are nutrient-dense and high in fiber can help you achieve the desired weight loss. DASH diet promises to add all food groups and follows the dietary guidelines. The DASH eating plan for a 2,000-calorie diet includes lean meats, poultry, fish 2 or fewer, nuts, seeds, legumes 4 to 5 per week, fats and oils 2 to 3, sweets 5 per week, grains 6 to 8, vegetables 4 to 5, fruits 4 to 5, fat-free or low-fat milk and milk products 2 to 3. Older adults. What is considered as being old? First and foremost, there is no biological definition that signals a person's becoming old. However, some governmental and other benchmarks do exist. A survey conducted by Pew Research Center found that an average does not feel old at all, and what is really considered old is completely dependent on one's age. Overall, the respondents of this survey said that old age starts at 68 years. However, the adults under 30 years of age considered the age of 60 as old age. World Health Organization sets the age of 60 when referring to aging the human populations. A question was asked and was reported in Old Americans 2008, which was a key indicator of well-being. According to the given response, 63 to 80% of older adults between 65 and 74 consider themselves healthy and want to lead a healthy life until death. However, the prevalence of chronic diseases like hypertension, diabetes, cardiovascular diseases, and cancers. If you have a chronic health problem, you cannot perceive a healthy life about yourself. This self-perception of good health depends on age. It turns down with increasing age. According to research, this self-perception in 85% decreases to 67% of non-Hispanic whites, 54% of non-Hispanic blacks, and 47% of Hispanics. Adequate nutrition helps to promote healthy living and reduces the chances of illness. The score for diet quality in younger adults is 65, while older adults have a diet quality score of 68. This score is measured by the Healthy Eating Index, 68 out of 100 points. This score measured by Healthy Eating Index for Americans aged above 2 years is 58 points out of 100. This is mostly seen that the prevalence of illness mostly brings the modifications in the patient's diet. He may suffer from depression or anorexia in the form of symptoms of the disease. Medical nutrition therapy, MNT, plays a vital role in promoting healthy food for treatment or suppressing the symptoms of diseases after diagnosing a particular disease. Registered dietitians observed the effective results that MNT is an efficient way to control diseases like diabetes mellitus, kidney diseases, hypertension as compared to consultation with doctors and dependence on medicines and drugs. Many studies prove the dependence of healthy living of older adults on a healthy nutritional status possible by adequate intake of nutrients through diet. The researchers of Lewin's group found that diabetes, renal diseases, cardiovascular diseases, and hypertension can fight against these diseases through medical nutrition therapy sessions, MNT. Physiological changes with age, cardiovascular system and reduced blood vessel elasticity, blood volume, stroke volume output, increased arterial stiffening, and blood pressure. Endocrine system. Reduced estrogen levels, testosterone, decreased secretion of growth hormone, increase in cortisol, stress, reduced glucose tolerance, reduced levels of thyroid gland secretions, reduced ability to convert provitamin D to vitamin D in the skin. Gastrointestinal system. Reduced secretion of saliva and mucus, missing or poorly fitting teeth, dysphagia or difficulty in swallowing, damaged, less efficient mitochondria produce less ATP, less energy, reduced secretion of hydrochloric acid and digestive enzymes, slower peristalsis, reduced vitamin B12 absorption. Musculoskeletal system. Reduced lean body mass, bone mass, muscle, and water, increased fat mass, decreased resting metabolic rate, and reduced work capacity, strength. Nervous system. Blunted appetite regulation, thirst regulation, reduced nerve conduction velocity, affecting sense of smell, taste, touch, cognition, change sleep as the wake cycle becomes shorter. Renal system. Reduced number of nephrons, less blood flow, slowed glomerular filtration rate. Respiratory system. Reduced breathing capacity, reduced work capacity, endurance. Nutritional risk factors. In adults, i.e., younger or older adults, dietary risk factors increase the chances of developing several chronic diseases like heart disease, cancer, and stroke. Individuals consuming a diet high in saturated fat, low intake of vegetables and fruits, whole grain products, and poor nutritional habits lead to obesity. Any of the following conditions potentially place older adults at nutritional risk: hunger, poverty, inadequate food and nutrient intake, functional disability, social isolation, living alone, urban and rural demographic areas, depression, dementia, dependency, poor dentition and oral health, chewing and swallowing problems, presence of diet-related acute or chronic diseases or conditions. Energy and nutrients needs. Energy expenditure is primarily determined from basal metabolic rate, BMR, which slows with age, the thermogenic effect of food, and an individual's physical activity energy needs. Carbohydrates intake should be up to 65% of total calorie intake. Men who need 2,300 calories per day need 288 grams of calories from the carbohydrates food sources. At the same time, women who have the same caloric requirements need only 188 grams of carbohydrates per day. Dietary fiber, a non-digestible form of carbohydrates, is also required for good health. About 30 grams of dietary fiber is needed daily. 14 grams of dietary fiber per 100 calories is required for male and female adults to maintain good health. Dietary fiber reduces the risk of coronary heart disease, but older adults are more often concerned with the role of fiber for gastrointestinal health. The role of dietary fat does not seem to change with age. High saturated fat and trans fat intake lead to risk factors for chronic disease. Minimizing saturated fat in the diet and keeping total fat up to 35% of calories is a reasonable goal for older adults to maintain a beneficial blood cholesterol ratio. Water content in our body decreases with age, and the water reservoirs also get depleted, which causes frequent dehydration in older age. Public health professionals monitor the general public's health by simply measuring the mortality and morbidity rates. Nutritional interventions are now being used as a medical toolkit to treat these deadly diseases. For adults 65 or older, the leading causes of death and their risk rates are mentioned below. Heart diseases contribute 29% of total death rates, cancer as 22%. Cerebrovascular disease as 7%, Alzheimer's disease as 4%, diabetes mellitus as 3%. If you are enjoying this video, please subscribe to our channel. Subscription is totally free. by pressing the subscribe button. Also, hit the notifications bell so that you will always be notified of new content on our channels. Heart disease or cardiovascular disease, CVD, is the leading cause of death in older adults. But the good news is that it is potentially reversible by adopting a healthy lifestyle, diet and physical activity. CVD prevalence rises with age. The American Heart Association states that CVD prevalence includes coronary heart disease, heart failure, stroke, and hypertension as more than 73% in men and about 72% in women aged 60 to 79 years. The risk of developing CVD rises with age and reaches 85.9% by the age of 80. In old age, risk factors for the cardiovascular disease remain the same as younger adults, including hypertension, i.e., 140 mm of mercury, 90 mm of mercury, elevated low-density lipoprotein, or LDL, at least 130 mg per deciliter, or diabetes mellitus. Nutritional remedies like the DASH diet, including healthy food items, are the most suitable CVD choice. A lifestyle that includes changes, like decreased amounts and type of fat, focus on 1 to 2 items to reduce saturated fat intake in an individual's regular diet rather than change many things, uses lean meats, and substitutes saturated fatty acids with PUFA and MUF. This diet also decreases synthetic trans fatty acids, reduce cholesterol intake, increases fiber, fruits, and vegetables, limit salt, exercise, maintains a healthy weight, reduce stress, and quit smoking. It can be proven very effective for cardiovascular diseases. Similarly, stroke, hypertension, diabetes, obesity, osteoporosis, and other health issues are prevalent among older adults. But they can be treated with proper lifestyle changes. For example, a good dietary pattern, the DASH diet, effectively treats these conditions. More than that, this diet does not impose any restrictions. So it can be followed very easily without excluding any food group. So, eat right, eat wisely, and be happy. Here ends this video on the keto diet and weight loss. Thanks for watching. Don't forget to check out our other videos in this series. Food as medicine. Remember to subscribe to this channel. Goodbye. See you again soon.